Patients' perceptions of physical therapy in managing musculoskeletal pain. Introduction. Musculoskeletal conditions affect joints, bones, muscles, and soft tissues and include more than 200 disorders recognized by the World Health Organization. These conditions are common across all age groups, with prevalence increasing with age, and include low back pain, osteoarthritis, rheumatoid arthritis, fibromyalgia, and other rheumatic diseases. Globally and in Bangladesh, musculoskeletal pain is highly prevalent and a major cause of disability, particularly among women and older adults, significantly impairing quality of life. Physical therapy plays a vital role in the management of musculoskeletal pain through therapeutic modalities, exercise therapy, manual techniques, and patient education. When appropriately selected and individualized, these interventions are effective in reducing pain, restoring function, and improving overall well-being with minimal risk. Despite growing evidence supporting physical therapy, patients' perceptions and satisfaction with these services have been inadequately studied in Bangladesh. Understanding patients' views is essential for improving service quality, treatment effectiveness, and rehabilitation outcomes. Therefore, this study aims to evaluate patients' perceptions of physical therapy for musculoskeletal pain in a tertiary care setting. Objectives. General objective: to find out the patient's perception on physical therapy treatment of musculoskeletal conditions. Specific objectives: to find out the impact of physical therapy on the quality of life of musculoskeletal pain. To find out effectiveness of physical modalities. To find out the service status provided by the stuffs related to physical therapy. Methodology. Study design and settings. This cross-sectional study for 1 year duration to find out the patient's perception on physical therapy treatment in musculoskeletal. Qualitative research approach was applied to explore the patient's perception towards physical therapy. Selection of patients. Patients who was eligible and given consent, between 18 and 65 years with musculoskeletal pain attending for physical therapy treatment to the department referred from outpatient department of different departments from physicians, general practitioners and other hospitals from different corners of the country was the population of this study. Whatever drug treatment regime was received by the participants, non-steroidal anti-inflammatory drugs, analgesics or steroid, for their musculoskeletal pain, those who attended for physical therapy and had fulfilled the inclusion criteria was selected for this study. Study population. Patients with musculoskeletal pain attended for physical therapy treatment to the department according to the inclusion and exclusion criteria was the population of this study. Inclusion criteria. All patients between 18 to 65 years, with musculoskeletal pain attended for physical therapy treatment. Patients who completed at least 5 sessions of physical therapy treatment. Male and female both sexes were the participants. Both literate and illiterate patient was included on the study. Exclusion criteria. Patient who was not be interested. Patients who were deaf and dumb and could not respond to questions. All the patients those were critically ill and could not respond appropriately to the questions been asked. Patients of psychiatric illness. Sample size and sampling. The samples were selected by convenience sampling method. A total number of 149 patients was selected as per inclusion and exclusion criteria. The sample size was determined by following formula. Study procedure. Steps of study procedure. Study procedure. Steps of study procedure. Step 1. Literature review, preparation of questionnaire, pretest form. Step 2. Data collection. Step 3. Data entry, edit and analysis. Step 4. Report writing and submission. Procedure of data collection. On fulfillment on inclusion and exclusion criteria and after taking informed written consent, all information was recorded in the data collection sheet. Interviewer-administered structured questionnaire was used in this study. With closed-ended questions, participants were answered according to focused and pertinent to the objectives. Structured questionnaire was developed to know the perceptions. It was an interpretive approach that enables gain an understanding of individual patients' opinions, feelings, attitudes, beliefs and behavior of musculoskeletal pain patients about physical therapy treatment. The interview was conducted in English and/or Bengali as though they can understand the questions easily. Face-to-face interview was conducted because this may provide higher response than other data collection methods. Every interview may need for 30 to 40 minutes. Statistical analysis. The data was collected by using a closed-ended questionnaire form and different codes was applied. Finally, the coded data were checked, verified for consistency and edited followed by analyzed and was presented as qualitative analysis. Coded data was directly be entered to the computer by using SPSS, statistical package for the social sciences, software, SPSS Inc., Chicago, Illinois, USA. Descriptive statistics was analyzed to calculate the frequency, percentage, mean and standard deviation of observed data. For the items assessing the perception, there are different response options. Spearman's correlation was used to assess the relationship between patients' perception with physical therapy services and other factors. Important tables, charts and diagrams were prepared on the basis of findings. Recording. Before admission into the trial, the nature of the study was discussed with the patients and verbal consent of the patients was taken. Results. Sex distribution of the study participants. The study demonstrated a male predominance, with nearly 2/3 of the participants being male. This finding may reflect greater occupational exposure to physical strain, higher workload, or increased healthcare-seeking behavior among males in tertiary care settings. Nevertheless, the substantial proportion of female participants, particularly housewives, indicates a significant burden of musculoskeletal disorders among women engaged in repetitive household activities. Age distribution and economic productivity. The mean age of the participants suggests that musculoskeletal disorders predominantly affect individuals in their economically productive years. The clustering of patients within the 31 to 50-year age group highlights the role of work-related stress, prolonged static postures, and cumulative mechanical loading in the development of musculoskeletal pain. Occupational distribution of the patients. Housewives represented the largest occupational group, followed by service holders and businessmen. This pattern emphasizes the contribution of both domestic and occupational physical demands to musculoskeletal morbidity. The inclusion of students, laborers, and farmers further demonstrates that musculoskeletal pain is prevalent across diverse occupational groups. Socioeconomic status and place of residence. Most participants belonged to the middle socioeconomic group, while a considerable proportion came from lower income backgrounds. This indicates that musculoskeletal disorders cut across economic boundaries. The predominance of urban residents is likely related to better accessibility to tertiary-level rehabilitation facilities in metropolitan areas. Educational level and marital status. The majority of patients were educated up to secondary or higher levels and were predominantly married. Educational status may influence health awareness, treatment expectations, and perception of service quality, while marital status may facilitate care-seeking behavior through family support. Clinical characteristics and duration of musculoskeletal conditions. Most patients presented with chronic musculoskeletal conditions lasting longer than 3 months, suggesting delayed healthcare access or persistence of symptoms. Low back pain was the most commonly treated condition, followed by neck and shoulder disorders, consistent with national and international epidemiological trends. Physical therapy modalities and treatment practices. Thermotherapy was the most frequently used modality, particularly short-wave diathermy, followed by ultrasound and microwave diathermy. These modalities are widely used for pain relief and functional improvement in musculoskeletal disorders. Short treatment durations likely reflect institutional workload and standard clinical protocols. Patient satisfaction with service delivery and waiting time. Overall satisfaction with service delivery was high, especially regarding staff courtesy and therapist behavior. However, satisfaction with waiting time declined with increasing educational status, possibly due to higher expectations among more educated patients for efficient service delivery. Perception of physiotherapist communication skills. Communication skills of the physiotherapists were positively perceived, with female patients expressing higher satisfaction than males. Effective communication likely enhanced patient understanding, confidence, and engagement in the treatment process. Adequacy of time spent with patients. Most participants agreed that sufficient time was dedicated to their treatment, indicating satisfactory therapist-patient interaction. Adequate time allocation is essential for proper technique, individualized care, and patient reassurance. Satisfaction with exercise instruction and demonstration. Although the majority of patients were satisfied with exercise instruction and demonstration, a notable proportion reported partial satisfaction. This highlights the need for clearer explanations, repeated demonstrations, and increased emphasis on home exercise programs. Satisfaction with facilities and equipment. Patients expressed moderate to high satisfaction with facilities and equipment, though complete satisfaction was relatively low. This suggests the need for ongoing maintenance and upgrading of rehabilitation equipment to meet patient expectations. Perceived treatment outcomes after physiotherapy. Most patients reported improvement following physiotherapy, supporting the effectiveness of physical therapy interventions for musculoskeletal pain. The small proportion reporting no improvement or worsening underscores the importance of individualized treatment planning and regular reassessment. Usefulness of therapy and departmental organization. The majority of participants perceived the physiotherapy program as useful, and appointment cancellations were infrequent. This reflects efficient departmental organization and reliable service delivery. Perception of treatment cost and affordability. While most patients considered treatment costs reasonable, a significant minority viewed them as unaffordable. Financial barriers may influence treatment adherence and continuation, indicating a need for cost-sensitive service planning. Overall satisfaction and recommendation of physical therapy services. Overall satisfaction with physical therapy services was notably high. Most patients expressed willingness to continue treatment and to recommend the department to others, reflecting strong patient trust and confidence in the quality of care provided by the Department of Physical Medicine. Discussion. This study included 150 patients with musculoskeletal conditions, showing a clear male predominance, 68%, which is comparable to findings of previous studies conducted in Bangladesh. The higher male participation may reflect increased hospital attendance and healthcare-seeking behavior among males, while female participation may be limited by social and cultural factors. The mean age of the participants was 40 plus or minus 14.02 years, with most patients belonging to the 31 to 50-year age group, indicating that musculoskeletal disorders commonly affect individuals in their economically productive years. This finding is consistent with earlier regional studies. Housewives constituted the largest occupational group, followed by service holders and businessmen, highlighting the role of repetitive domestic tasks and occupational workload in musculoskeletal pain. Most patients belonged to the middle socioeconomic class, a pattern also observed in similar studies, possibly due to limited access of lower-income populations and preference of higher-income groups for private healthcare facilities. The majority of patients were educated up to secondary level or higher and were predominantly married. These socio-demographic factors may influence patients' treatment expectations, satisfaction, and adherence to physical therapy. High levels of satisfaction were reported regarding staff courtesy, therapist behavior, communication skills, and appointment management. Satisfaction with waiting time declined with increasing educational status, suggesting higher expectations among more educated patients. Most patients reported that adequate time was allocated during therapy sessions and expressed satisfaction with exercise instruction and demonstration, though partial dissatisfaction in this area indicates the need for improved patient education and supervision of home exercise programs. Facilities and equipment were generally rated favorably, though complete satisfaction was not universal, suggesting scope for further improvement. In terms of treatment outcomes, the majority of patients reported improvement following physiotherapy, and most perceived the treatment as beneficial. Female patients reported slightly greater perceived improvement and usefulness of therapy compared to males. High levels of willingness to continue therapy and compliance with exercise advice reflected effective therapist-patient interaction and self-motivation. Conclusions. Satisfaction and positive perception is an essential part of disease recovery process during treatment of the patients, which is found among the patients in the Department of Physical Medicine, though there are a very few different opinions. Positive perceptions and positive opinion of the patients will encourage the service provider's confidence. Recommendations. Every institute should be aware of the patient's perceptions and opinion. It will in turn improve the service of the institute. Physiotherapists or other staff of the respective department should be sincere to treat the patient and make themselves to be devoted for providing best service.